More than 50 countries have missed the World Health Organization's target for 10% of their populations to be fully vaccinated against COVID-19 by the end of September. Most are in Africa, where the WHO's overall figure for those fully vaccinated is currently at 4.4%. In the United Kingdom, nearly 66% of the whole population has been fully vaccinated. In the EU, about 62%, and in the United States, it's about 55%. Many of the countries who have not reached their 10% target are low-income countries grappling with vaccine supply and health infrastructure issues. Some suffer from conflict or civil unrest such as Yemen, Syria, Iraq, Afghanistan and Myanmar, while others like Haiti have been hit by natural disasters, making the task of rolling out vaccines very difficult. In Africa, only 15 out of 54 countries have achieved the 10% target. Half of the countries on the continent have vaccinated less than 2% of their population. Some larger countries with big populations have fallen far short of this target. Egypt only has about 5% of its population fully vaccinated, with Ethiopia and Nigeria each sitting on less than 3%. Two countries on the continent, Burundi and Eritrea, have yet to roll out vaccination programs. For more, we're now joined by Dr. Mary Stephen from she's the Technical Officer for the World Health Organization's Regional Office for Africa. Dr. Stephen, a very good evening to you. Thank you so much for joining us. It's always a pleasure having you join us on The Globe this evening.
Good evening. Thank you for having me.
More than 50 countries, we've been told, have missed the World Health Organization's target for 10% of their populations to be fully vaccinated against COVID-19 by the end of September. What does it mean in the bigger scheme of things?
Yeah, thank you once again. Yes, in Africa, like you said earlier, only 15% of the countries have met this 10% target by the end of September 2021. And just to give you a quick statistics of where we are as of today with regards to the vaccination, we have received about 200 million doses so far, 153 million doses administered, and over 60 million fully vaccinated. So now what it means is that if you have about 4.4% of the Africa's population not vaccinated, it means that you have a large pool of susceptible people that, of course, are at very high risk of contracting the COVID. So it means that if we have another variant, for instance, that is highly transmissible, it's going to be spreading faster than what you have across the world, where you have more than 50–60% of the population vaccinated. So yes, the risk is high in populations where vaccination is very low.
But was the target realistic though, Dr. Stephen?
Yes, the target was realistic of 10% globally for countries to reach by the end of 2021. I think majority of the countries in Africa, they actually face this issue of vaccine supplies, because if you look at the 15 countries that met the target, they had quite impressive supply of vaccines, right from COVAX, from the AVAC facility, by bilateral donations. So they had like a consistent flow of vaccines compared to some of those countries that are still having challenges. So yes, the target was realistic, but of course the issues of supplies was one of the limiting factors for many of the countries in Africa.
I mean, only 15 African countries have now fully vaccinated 10% of their people against COVID-19. It seems we're still a long way to go. Is it an issue of capacity, or is it an issue of supply?
Yeah, a very long way to go indeed for the continent, because if we want to limit the transmission of COVID, we need to make sure that we ramp up the number of people, or the percentage of population that gets vaccinated against COVID. So one of the major issues that Africa has dealt with is the issue of vaccine supplies and the predictability in terms of receiving vaccines for countries countries to be able to plan ahead of time so that they can anticipate some of those doses arriving. So the supply, yes, is the major things. We know that some few countries, of course, have issues with logistics, cold chain, but that is not the major challenge. The supply is the major challenge on the continent.
And almost 90% of the high-income countries have met this target. Is Africa's prospect solely on the hands of the rich nations?
That's a very good question. So I think every emergency comes with an opportunity actually to improve our systems and our capacities, and definitely COVID will leave us in a better place than where it met us in February 2021. A lot has happened. So what we need to be doing in Africa is to leverage the emergency to ramp up our capacity. One of those capacities that definitely we need is our manufacturing capacity, both for vaccines, for therapeutics, for the personal protective equipment. So we need to ramp up this capacity so that next time when we are faced with a similar challenge, we can actually respond more effectively. So yes, we need support from the high-income countries, but we also need to make sure that we are ramping up our own capacities.
So, Dr. Stephen, what then can we do as Africans, through bodies like the African Union to ensure at least 70% vaccination across the board?
Yeah, so the first thing, I think, immediate things that can be done to ramp up the vaccination campaign. We talked about the issue of accessibility for vaccines, so we have to continue to advocate for availability of vaccine to African countries. And for those countries that have already vaccinated over 60, 70%, to share those doses with Africans so we can ramp up. Secondly, looking at the medium long term, the capacity to produce this vaccine on the continent is very, very important. And the AU has that leverage or advantage to make sure that we are ramping up these capacities. Like I said earlier, it's not just for today, for COVID response, but if we have this capacity for production of COVID-19 vaccines on the continent, we can still use the technologies for other vaccines and other diseases in the future. So we need both immediate term and long-term plans to ramp up this vaccination access.
And we have a country like South Africa which has moved to level 1, yet it still has not met any of its targets. At this stage, Dr. Stevens, what imperatives should hold fort? Is it livelihoods or lives?
So it's not an either-or situation. We need both. Livelihoods, we need to make sure that people are able to access commodities, they are able to feed, they are able to take care of their families. And we also need to make sure that we prevent the spread of the COVID to save lives. Or the unnecessary deaths from COVID that happened during this pandemic really is something that if we have opportunity, we should, as much as possible, try to prevent it. So what we advise countries is to make sure that we are balancing the situation. The economy, livelihoods is very, very important. The COVID-19 response is also very, very important. So while we have reopened already, we need to make sure that some of these public health and social measures are being complied with, especially not just the government, but us, the general population. Let's do our part. If they say we should wear our masks, get vaccinated, we should do that, avoid unnecessary mass gathering, because we are not there yet. The risk of COVID is still very high, especially on the continent where vaccination coverage is very, very low. So both sides, government is doing its effort trying to balance both economy and the COVID response, but the general population must also contribute to ensuring compliance with these public health and social measures.
And what's the picture like of infections and new cases? Is the Delta variant still a dominant and a deadly variant?
So for the continent, we have seen a consistent decline in number of cases over the past 10 weeks. And the good news is that in the last 2 weeks, we saw a 30% decrease in number of cases. Last week, we saw 35% decrease in number of cases. So yes, we are going towards the downward trend. But at the end of the day, this is not a battle that is won. We need to make sure that we are very, very, very vigilant in terms of observing the measures. Our capacities are in place. Where we need to ramp up these capacities, especially for surveillance, diagnostics, therapeutics, and access to early treatment for patients, we need to do that ahead of time because the risk is still there. Like we said, we have very much large susceptible population on the continent with only about 4.4% of the continent's population fully vaccinated. So all these efforts are important. Yes, we celebrate the good news. We are not there yet. So let's continue to be vigilant and do what we have been doing, and where we need to improve on those things.
All right, Dr. Stevens, lovely chatting to you this evening. Thank you so much for joining us.